Understanding speech delay in children. What are the signs of speech delay? A child by 9 months is not babbling, not even saying baba, mama, not imitating sounds, anything that you make. The child has other developmental issues because of which the child is not answering to its name. You call the name, the child is not responding. By 12 months, the child is not saying words, very few vocabulary. By 2 years, the child is not even come to phrases, maybe just saying 1 or 2 words. That also not very clear. Not understanding what is happening in the surrounding and not responding to anything. Now the child is 3 years and can talk little bit perhaps, but only to those who are familiar to the child, not able to communicate well with unfamiliar people whom you do not know them. There are definitely other signs, as we know, when there's no articulation, not clear, slurry speech. The child is not showing any response to even gestures with sound, not making any actions while talking, no eye contact, talking somewhere else, looking somewhere else, not understanding what is being said to the child, so the child is not responding at all. What are the causes of speech delay? Why does speech delay happen? Speech delay is something which is a developmental task. So if the child is sitting late, crawling late, walking late, speech may be delayed also. There is another reason why the child cannot speak on time is because of the oral motor strengthening. A lot of muscles which are involved, your tongue, your teeth, your lips, everything has to work in synchronization for the child to develop proper speech. Another reason could be autism spectrum disorder. There is a huge amount of communication disorder in such children. Children who have hearing loss, if you can't hear, you may not answer, you may not listen to sounds, you may not catch those sounds, those wavelengths to answer them. There is a speech delay in those children who are not exposed to adequate language. There is insufficient exposure to such vocabulary, such words that the child doesn't pick up and answer back. Or with language comes bilingualism. There are 2-3 languages spoken to the child. Child doesn't know which language to respond to. So there is a speech delay with that. And definitely there could be some other underlying medical conditions, some surgeries because of which there could be a delay in the development of speech, which definitely needs attention. Your child has a speech delay, but when to seek that help? Early intervention is the best. The moment you understand the child is not responding, get help for your child. Get your child evaluated. Get your child assessed. Find out the reason. It could be any one of the reasons that you've got. So early intervention programs is the most important. Evaluation from a speech therapist, evaluation from an early interventionist, so that if there are other underlying causes of delay also, you would know that there could be a speech delay later on as well. Never wait that it will happen. Your child will catch up. Do catch up yourself before it is too late.